something which has been proven scientifically that we can alter our gene expression by how we live. And that is why I tell patients that epigenetics is what led you to this space.
So we've talked a little bit about the idea of what does fitness look like? What does it mean? How would you explain it to your clients and to yourself? And I think the distinction there is, where you're at with your fitness, you understand the purpose, the motivation, why you're doing it. So that conversation might look different than somebody who's maybe in a little bit less of a healthy place in their life. There's a reason, usually, probably, they're coming to an interventional cardiologist. And so the conversation of why should we exercise probably looks different. I assume that most of the people that you're working with, obviously there's going to be genetic issues that you might be dealing with on a case-by-case basis. But for the most part, a lot of this may be behavioral based, and they're probably on a sicker end of this physical health spectrum. Would that be correct?
Yes, and I'm glad you brought up genetics, because that is something which is commonly asked, of us when we are visiting with our patients in clinic. And I often, stop and tell them that, look, it is genetics. Heart disease is the number one killer, and I think that globally it is. And I tell them as much as we want to blame our genetics and not ourselves and our behaviors, the truth is that it's not only genetics, it's epigenetics, right? So it's the combination of epidemiology and your genetics. So we have the power to alter our gene expression by how we live. And that is not something which is out there or voodoo. It's something which has been proven scientifically that we can alter our gene expression by how we live. And that is why I tell patients that epigenetics is what led you to this space. So it's definitely the foundation is your genetics, but then it's how you eat, it's how much you exercise. And I think pretty much between those two aspects, right? How you eat and how much you exercise. That is like more than 70% of the battle, right? Because a lot of the lifestyle risk factors, which then go on to become manifest heart disease, we know are, high cholesterol, diabetes. Now, I know type 1 diabetes is something which is not, it is not lifestyle. It is basically a deficiency that happens. It's autoimmune in nature. So I get that, but a lot of the patients we see are type 2 diabetics, and this is all insulin resistance. This is all fat built up around the organs, which we call as visceral fat, and then there is superficial fat. A lot of that is modifiable. So I often tell them that we lose fat in the kitchen, we gain muscle in the gym. There is no way you can outrun a bad diet. You can exercise as much as you want to. But I think at the end of the day, you are going to lose fat in the kitchen. You're not going to lose fat by, exercising and then having a large meal as soon as you're done with your workout in the gym. I think it's, I think that's a crucial message, for patients. So I tell them it's a combination of how you are living your life, and it's a combination of your genetics. And I stress upon them that it's crucial to exercise. Well, these are recommendations from the American Heart Association, but I think 5 days a week, 30 minutes every day, low intensity exercise. If you're doing moderate intensity exercise, and I think resistance training falls into that, then, at least 3 times a week for at least up to 60 minutes a day. Those are the recommendations. And don't quote me on the second one, because a lot of patients don't want to hear moderate intensity in 60 minutes. So I think I sort of limit it to just 30 minutes a day. Low intensity could be walks, 30 minutes of walking every day. I think that's all that's needed. That's all that's required for, to achieve a bare minimum threshold for, healthy practices. Then, certainly watching what you eat is I harp on that quite a bit. I mean, I tell them, diet which is rich in fruits, vegetables, whole grains, legumes. When it comes to beverage, I tell them water is the best beverage. You can have tea, you can have coffee. And then they say, well, doc, tell us how do we have like 4 to 5 servings of fruits or vegetables, per meal or every day. And I'm like, it can be a task. So I think as long as you are seeing 4 or 5 different colors on your plate, when you're eating, whether it's lunch or dinner, I think you're gonna meet your goals. So as long as you can see, as long as you can see or count 5 different colors on your plate, whether it's lunch or dinner, you are going to meet your daily leafy green vegetables goal and your daily fruit intake. So those are some of the very practical aspects that I share with them. And then some are motivated to just have lifestyle intervention and see how their cholesterol levels plummet after lifestyle intervention. Some obviously need a drug. This is in Indiana, right? When I tell them no red meat, I get a stare. Like,
oh boy.
So it's like, I'm not saying, completely no red meat. I said limit the intake of red meat, I think. So, those are some of the discussions that I have with patients on a regular basis in clinic after they've either had a heart attack or they've found that their calcium score, which is a screening preventative exam that we offer to our patients, is elevated, or they have had a family member who had a heart attack. That is an eye opener for quite a few of them. Or they've gotten their routine blood work and their cholesterol levels are high. And those are some of the opportunities we get to interact with patients and talk to them about preventative care and lifestyle.
Yeah, that's powerful. And I want to hear a little bit more, because you just started to dabble into the very question that I was going to follow up with, which is this idea of kind of what are the signs and the symptoms of somebody that's in that world of sickness. And I think it's really important. The unfortunate circumstances that the things that are happening inside of our body that are leading to disease happen so quietly that by the time that they express themselves outwardly, we've gone quite a bit down the road. Our body is very resilient. It will get through a lot of bad things until finally the last thing is you have a heart attack. So could you share a little bit, Ankur, the things that you're looking for as a doctor that would lead you to believe that somebody is either very, very sick? I mean, obviously having a cardiac arrest is a really big sign that you're sick, but maybe what are some of the other things you're looking for as a doctor that would let you know somebody is trending in the wrong direction?
Yeah, so, I think we discuss a lot about exertional intolerance. Many times patients come see us, or patients get referred to us because there is chest pain. They're experiencing chest pain on exertion. That is, and the chest pain is getting worse. So they were maybe able to walk a block, maybe they were able to walk 2 blocks. A few weeks ago, or a few months ago, now they're barely able to walk a block. They have to, stop, take rest for a few minutes before chest pain goes away, and then they can resume walking. That is a pretty telltale sign of what we call as angina. Angina means if someone presents to you with angina, what that means is that you have a blockage in one of the arteries that is running on the surface of the heart. and that is the reason why you're having symptoms. Now you can treat the angina with medications, but if it keeps progressing, if the duration of physical exertion keeps decreasing, and your symptoms are becoming more premature in onset as you continue to exert yourself, then that is a sign that you have what we call as unstable angina. So that falls under the spectrum of someone having a heart attack. So those are some of the crucial telltale signs to be mindful of, or some of the signs that we discuss with our patients. The other big one, so each time someone is, for example, taking a flight of stairs or 2 flights of stairs and has not felt short of breath and is now feeling short of breath, that is another telltale sign that something is brewing in terms of a blockage, which may be decreasing their exertional capacity or their exercise tolerance. So one of the screening tests, at least, we have a plethora of screening tests we can offer to patients now, but one of the most, I think, useful or most insightful, I think is a good word here, screening test, which I like to order is an exercise treadmill with an imaging modality, for example, an exercise stress echocardiogram. And the reason why exercise is crucial, putting patients on the treadmill is crucial as a medical test, is because it not only gives you information on their heart rate as to what it does when they are on the treadmill and exercising, it also gives you information on their functional capacity, which has prognostic information. So if someone is able to exercise for several minutes on a protocol that we use, which is a fairly standardized protocol for exercise on the treadmill for this test, and say has 10 metabolic equivalents of functional capacity, well, that tells you that, okay, no matter if he or she has disease, the fact that particular person or that particular patient has a functional capacity which is 10 metabolic equivalents in a few minutes, that's a good prognostic marker, meaning that they are going to have despite the disease, are going to have a good outcome because their functional capacity is healthy. So I think those are some of the symptoms to keep in mind. Exertional intolerance, exertional shortness of breath, chest pain on exertion, at times profuse sweating, with the sense of poorly localized chest pain. I think these are some of the important signs to keep in mind, symptoms to keep in mind when thinking about heart health or heart disease.
Absolutely. So when you think of the other end of the spectrum of fitness and sickness, right? So we talked about what are the signs, the symptoms, what's going on the sickness end of things. When you think of the other end of the spectrum as it relates to physical health in your work that you do, what are some of the things that you're looking for that are signs that things are going well, that they're fit? Obviously, just there's no sickness, but I'd like to believe that there's more to life than just the absence of sickness, right? So what are some of the things that you would be looking for to let you know that somebody is well on the other end of that spectrum?
Yeah, so, again, patients will tell you that they're, after we've addressed blockages, or after we've been able to address the symptoms that they came and saw us for, they will tell you that I feel that my breath is back. I was not paying attention that how bad I felt until this happened, and now I suddenly feel that I'm able to walk more and not feel as winded as I was feeling winded, and I was attributing it to just getting old. That is one of the most common feedbacks, or one of the most common things that patients share with us. So you will know that I'm able to do more, walk more. I'm able to, I feel more agile. I feel more active. I feel more more at ease with my breath. These are some of the words that patients will use to describe how they feel after you've addressed their symptoms and after you've addressed their blockages. Sometimes, their spouses or significant others will tell us that their color is back. They were looking pale, before these blockages were addressed, and now I see that their color is back. We get to hear that a lot, not from the patients, but from their family members. From their, if it's an older patient, then from their kids, or if it's a younger patient, then from their spouses, that his color or her color is back. That is some of the other very common feedback that we hear. And then we obviously are going to look at some of the anthropometric or metabolic parameters, if you will. So for example, how well is their blood pressure, how well is their heart rate, are they on appropriate medications? We actually get the information on whether or not they're refilling their medications from their pharmacies, just to make sure that they're adherent to the medications that we prescribed. We look at, certainly, blood glucose levels. We look at kidney function. We look at liver function panel. We look at the thyroid gland. Some of the other important organs which have an important role and interplay with heart disease. We sort of look at all the metabolic parameters to make sure that there are no other metabolic derangements which can be optimized or rectified or treated medically to achieve optimum long-term health. So those are some of the sort of data points we garner when we want to ascertain how well patients are doing after we've done procedures on them.
Yeah, that's great. That kind of brings me to the next question, and I want to allude back to a comment you said earlier, which is that people are typically, when they're seeing you, it's not because they want to, it's because they've gotten to a point where they have to. And I really appreciate how well you recognize that people are in a place in their life where like something has gone wrong, and they probably are frustrated, they're afraid, they're scared, they're judging themselves for letting themselves get to this place, whatever they happen to be, but they're probably not in a positive space. So recognizing that the goal would necessarily to not to go see you at your job, at least, right? Knowing that, I'd love to hear two aspects of this in regards to attributes that we can measure to let us know where we're at in our wellness, specifically kind of in our heart health. So what are some of the things that people can do prior to going to seeing you, things that they can maybe do on their own, or maybe with the help of a fitness professional or somebody who has a little bit of knowledge in this space, to let them know where they're currently standing in their health? And then what can they do? What would they go to you for specifically to measure? What things are you measuring with your clients to really truly know where they stand on that spectrum?
Yeah, I mean, I think you're sort of alluding to the notion of what we call as, primary prevention, meaning, prevent before there is an event. I think is now an evolving space, a thriving space, not only an evolving space, it's a thriving space in cardiovascular medicine and in cardiology. In fact, you have cardiologists who devote an extra year of training after general cardiology, learning about pathology and disease. They're now devoting a year of training in what we call as preventive cardiology, meaning, they are advocating for prevention before the disease onset, takes place or is occurring. To answer your question, I think few things to keep in mind, in terms of your heart health or your aerobic health, or your cardiovascular health, for lack of a better word, is again your functional capacity. So how much are you able to move or exert yourself? And we have so many Fitbits available these days. I mean, including I mean, Apple does a great job in terms of documenting, heart rate, documenting that there's also a reliable EKG software, which is built into the Apple Watch now. And then, it will count steps for you. I think overall 10,000 steps a day is a great goal to achieve. Some do food logging. I do food logging myself. So I want to make sure, how much I'm putting in, what I'm putting in exactly. So I think that is a good barometer to sort of be mindful of. And then I think that the one thing to keep in mind, I always do that when I'm on the treadmill, is how quickly am I recovering from my heart rate, which is something which is known as heart rate variability. So if you recover fairly quickly from your, target heart rate at peak exertion, which is 85% of 220 minus your age. It's the modified Carbonen's formula. So 220 minus your age, 85% of that is your target heart rate at peak exercise. So if you achieve that during a treadmill run or, training for a marathon or a jog, if you do that, and then if you see how quickly it returns back to baseline, how quickly it returns is directly proportional to how strong your cardiovascular health is, because it tells you that you are metabolically and cardiovascularly very healthy. So that is something you can keep in mind. I think when it comes to primary prevention in our offices, again, I think getting a calcium score, which is basically detecting calcium in the arteries that are running on the surface of the heart. So it's sort of a marker of disease. It's a marker of subclinical disease. You can still be completely asymptomatic and healthy, but if you have calcium built up in your arteries, it tells you that you have plaque built up, and that's old plaque, because that's how the physiology works. Plaque, when it gets old, it becomes calcified. So if you have calcium in your heart arteries, it tells you that you have old plaque, and by virtue of you having old plaque, you also have new plaque, and it's the new plaque or the soft plaque which is what causes problems in people, which is what ruptures and causes a heart attack. So I think if people want to know if they have plaque built up in their heart arteries, I think calcium score is a great screening tool. Yeah. And then many of them.
Correct me if I'm wrong.
Yes.
I just want to ask from what I've done, the research I've done, and what I've heard, that can start as early as in your 20s, and you'd have no signs of it until you had a heart attack in your 50s or 60s. Correct? So being able to get a screening like this, especially early on, would be very vital for people.
Absolutely. So you're absolutely right. I think what happens is that plaque buildup starts in our teenage years. So that's why, to the point that I said earlier in the show, that you can't really outrun a bad diet. The process of atherosclerosis and plaque formation is starting when we are very young. So what we ate in our teenage years and as kids has a huge role to play in what is going to become manifest in fourth, fifth, sixth decade. So it's crucial to begin early. That in our field, in the field of preventive cardiology, has been given a new term. It's called primordial prevention. So it's not only primary prevention, it's primordial prevention, meaning you're beginning very early, even as a kid or as a teenager. Watching what you're eating is crucial. So yes, I think all that plaque for all those decades, as you can see, it takes time to build all that plaque. And once that plaque gets old, you can detect it. Even in the absence of symptoms, you can detect it subclinically in the form of calcium score. And then, in the absence of symptoms, what we typically tell patients is, okay, start watching your diet. We typically would start them on a medication called a statin, which is a cholesterol-lowering medication. And, then the next question is, well, can this calcium go away? And, the answer is, so far, no. So far, we don't have any strategy to sort of dissolve, for lack of a better word, or mitigate the amount of plaque that has been built up. There are drugs now which are being studied which can regress, plaque volume. And I think that's going to be the next frontier of preventive cardiology. But so far, what we have now is we can start you on aspirin, daily aspirin. We can start you on a statin, which is a cholesterol lowering medication. We talk to them about lifestyle intervention, like we talked about earlier in the show, watching what you eat, fruits, vegetables, whole grains, legumes, nuts, olive oil, tea, coffee, water. That's the diet that you should be on. We actually measure their cholesterol levels. Want to make sure that the cholesterol levels are within the normal range, and even strive for lower values for the bad cholesterol. The lower we can get there, the better it is. It's safe to be extremely low. Then we educate them to watch for symptoms, like we discussed, watching for chest pain, watching for exertional shortness of breath. So all those symptoms they should be watching for, in addition to doing all these things, like we just talked about. So I think in terms of when you are assessing your own health, keep these symptoms in mind. Look for heart rate variability. How quickly can you get back to your heart rate at baseline after you've exerted yourself? I think that's a good marker of physiological fitness. And then, if you want to get more deep, certainly objective parameters and testing are available.
Okay. So just out of curiosity, just for people listening, if they're like, oh, okay, wow, the plaque that I have built up is not going anywhere. The best way to do it, the best way to really focus on improving is to prevent. I'd love to know more about my calcium score. What would you suggest it would be a good first step? Where would they go? Who would they call? What would that look like?
Yes, I think there are health systems. Certainly in the state of Indiana, certainly the health system I work for, we are offering calcium scores. We're offering these screening exams, calcium scores, at a very cheap price. So all they need to do is, call their regular doctor or their primary care physician and say, look, I need to get a calcium score. Or they can just get that done on their own. They can just, go to a facility which is offering a calcium score and say, I want to schedule for a calcium score. And, they will get a calcium score. And then, depending on, there are different, we grade these calcium scores according to, their age and their race. They can actually also go online and Google what is called as MISA, which is Multi-Ethnic Study of Atherosclerosis. So MISA calculator actually is going to tell you where your calcium score is based on your race and your age as to what percentile you are. And if you're at a certain percentile, then you'll be like, okay, I am at this percentile of people my age and people my race. And then, that is usually a very strong sort of motivator for people to then seek an appointment with a cardiologist, or, at least, start talking about, preventive health, getting more mindful of what they're eating, getting more mindful of their diet, of their cholesterol levels, of how much they're moving, their exercise. We sort of have a detailed discussion. And these are motivated patients who then come and see us because they're like, what, I got my calcium score and, I'm in the 90th percentile for my age and race. Now what do I do? So, a lot of times it's just reassurance. We want to make sure that they're not having any symptoms, which is almost always the case. So if they're having no symptoms and they have this calcium score, we typically would start them on a daily aspirin, put them on a statin, which is a cholesterol lowering medication, get their cholesterol levels checked, get their blood glucose levels checked, basically get a full metabolic profile, in terms of kidney function, liver function, triglycerides, bad cholesterol, good cholesterol, total cholesterol. Talk to them about exercise, and educate them on diet and dietary patterns. That's what we do.
Yeah. I think that's phenomenal. And it sounds like the earlier they do that, the better, because the more the more motivated you're going to be. Oh, wow, I really need to handle this, especially since plaque isn't going anywhere. And it's something that we need to address now and instead of later, for sure.
Absolutely.
For sure.
Yeah.